All right, so I'm back. We just talked about the larynx. I'm going to move on to the trachea. Basically, the trachea is really simple. It is just a pipe that connects our mouth to our lungs. The thing that you need to know about the trachea is that it's supported by cartilage rings, and we have the hyoid bone. Remember, we talked about that bone underneath the mandible. We also talked about how that's often the bone that is damaged during the strangulation event, so it often shows up on what's the word, on an autopsy. Okay, as an indication of damage caused by strangulation. Okay, so if you run your finger along your trachea, which is kind of weird and feels a little strange, you can feel the cartilage rings that roll around it. And basically, the whole point of them is to stop your trachea collapsing. Okay, it's probably one of the most important things, heart beating, um, to keep you alive. Okay, that trachea has to remain open to call what's called a pattern airway between the outside world and your lungs, because if that gets sealed off, shut off, then there is no breathing and there is no life pretty quickly. Okay, so those cartilage rings play an important role to keep that trachea open. Occasionally, you might have heard of the phrase a tracheotomy. If we have damage to the trachea or a blockage that can't be fixed, sometimes they will place a tube directly into the trachea in the neck to allow the person to breathe through that tube. Um, I dealt with those a few times. In the ambulance, I can remember having a patient who was breathing through a stoma, it's called, which is basically the hole in the trachea. Um, it's pretty surreal to see. And this person had a lot of fluid in there, so he had a little kind of pen suction tool to pull the fluid out so that the guy could continue to breathe. Okay, let's look at what's next. I really need a remote so I don't have to keep leaning forward. Okay, so a couple more structures we're looking at. We have the diaphragm. This is one of the two breathing muscles. Remember, the other is the intercostals in between the ribs, but the diaphragm sits below your rib cage, and basically it separates the two major cavities in your torso. So we have above the diaphragm, we have the thoracic cavity, which includes the lungs and the heart. Below that, we have the abdominal cavity, which a whole bunch of our organs and intestines sit in that. Um, so basically, the diaphragm is this smooth muscle because it works without conscious control. Like when you're asleep and not thinking about it, you continue to contract the diaphragm, so you continue to breathe. So it's a smooth muscle. You do have some conscious control over it, like you can hold your breath for as long as you want until your brain kicks in and tells you, no, you need to breathe so you don't die. So it's kind of one of those muscles that's a little bit of a tweener. It's mostly unconscious control. And basically all it does is it changes the shape and size of your lung cavity to allow oxygen to come in and out. Okay, I'm going to have to get the whiteboard out in a minute to show you how that works. Okay, so next up we have the bronchi. This is where the trachea branches out in two, going into the two different lungs, the left and the right. And it's basically just a passageway to get the air into each of the individual lungs. Okay, the breathing process. So we don't just suck air in or out or push it with our mouth. Basically, we're creating pressure differences using the diaphragm. Okay, the diaphragm alters the pressure inside of your lungs to allow air to rush in or out. I'm going to need the whiteboard to show you how this works. So I'm going to pause the video and we'll move on to part 3.